Hi, we're in the home stretch. This is really the last conversation that introduces new ideas about what you need to know to manage your borderline personality disorder. We've already talked about general principles you need to know in order to approach treatment, as well as common factors. We just discussed the limited utility of medications. Now we're going to talk about the psychotherapies that have been proven effective for borderline personality disorder. Psychotherapy is really considered the gold standard treatment for this condition. The good news is there are many different treatments that work for borderline personality disorder that are psychotherapeutic. I'm not going to go over them right now because the major thing you need to know is that they all work and none of them are superior to the others. What I would say is it really depends on what you can find in your area and connect with, because oftentimes these treatments are in short supply. I'm going to go over the ideas that drive two of the most available treatments so that you can use these ideas to help yourself regardless of whether or not you find these treatments. The first of them is called Dialectical Behavioral Therapy. I'll call that DBT for short from now on. DBT is what we call a cognitive behavioral therapy. It really focuses on changing your thoughts, feelings, and behaviors in a way that helps you achieve your goals and live by your values. Dialectical Behavioral Therapy, or DBT, thinks about BPD as a problem of emotional dysregulation. People with BPD are sensitive to negative emotions and react in ways that are unskilled. What people with BPD can do is learn skills to better manage. There are 4 sets of skills that those with DBT will teach patients in order to stabilize their tendencies towards emotional dysregulation. The first set of skills have to do with tolerating distress. This is basically that concept of thinking first. When people are really upset, sometimes they need to hit the pause button and slow down so that they can calm their brains to a point of thinking more clearly and making better decisions. The next set of skills have to do with emotional regulation. There are a lot of things that we can all do to improve our likelihood of being able to manage our emotions so that they're more stable and more predictable. The next set of skills have to do with mindfulness. Mindfulness is ubiquitous in many areas of healthcare, and basically it has to do with regulating your attention and reactivity to the thoughts that go on in your mind. Lastly, there are interpersonal effectiveness skills that help people manage their interactions with others so that they get what they want from those relationships, they maintain the connection with the people in those relationships, and they sustain their own self-respect. What's most useful about DBT is that it provides these 4 sets of skills that really can help anyone feel more effective in achieving their goals and living by their values. When we're more effective at achieving our goals and more consistent in living by our values, we can improve our self-esteem. This can make life a lot more meaningful and worth living. The second treatment I want to bring your attention to is called Mentalization Based Treatment. We'll call that MBT for short. MBT was developed in the UK, and it's more common in Europe. It has some valuable ideas that are quite different than the ones I've explained are part of dialectical behavioral therapy, because it's more of what we call a psychodynamic treatment. It really looks at the thoughts that go on in the mind. That is how we see the world and what happens in interpersonal relationships. So the idea in MBT is that BPD is a problem of mentalizing. What mentalizing has to do with is understanding what is behind the interaction between ourselves and others in relationships. So when we think about what's going on behind the scenes of relationships, we have to imagine things like thoughts, feelings, motives, wants, desires, needs, intentions, etc. in ourselves and others. What MBT encourages is to be able to think flexibly, realistically, and benevolently about what happens in our relationships. When we can develop alternative ways of thinking about stressful interactions we have with others, this gives us a greater sense of control and more options with which we can decide how we're going to respond to an interpersonal event. When we take more time to think first about what's behind the things that happen in our relationships, we can get to a point of feeling that interactions with others are more coherent. When we feel that our interactions with others are more coherent and predictable, it makes it easier for us to remain in the social world. So when we're mentalizing and have stable interactions, that enables us to learn from our experience and learn from others. Obviously, this is very important when people start to go to school or go to jobs where they have to learn how to do things and learn how to interact with the people around them. This enables people to gain what's called social capital. That is a sense of self-worth and belonging in situations that involve other people. And that can heal a lot of the difficulties of BPD. I'm not sure you're going to choose to or access these treatments that I've discussed with you today, but I think you can use their main ideas to provide a healing myth for yourself so that you can create expectations to change and start doing things differently, regardless of when or where your next step is. So we've made it to the end of all the conversations I wanted to have with you so that you're properly prepared to go forward after receiving the diagnosis of borderline personality disorder. In our very last conversation, we'll talk about the 10 tips that we've reviewed in the last 2 weeks. See you there for the last time.